The folks who live in parts of LA County, especially on the west and the north side, are not aware that there are actual two separate institutions at the USC Health Sciences campus, and that they provide a different vignette and a different range of services for patients with chronic respiratory disorders. So there are, in fact, when you talk about USC, most people think about the old County General Hospital, the one you used to see in General Hospital. It is still shown as a logo on the old TV program. There is now a new LA County USC Medical Center, which actually opened exactly 2 years ago. It is very modern, very state-of-the-art. It contains 3 units, an inpatient tower, an outpatient clinic tower, and a diagnostic and therapeutic unit. Consists of 600 inpatient beds. And it continues to see about roughly 800,000 visits per year to the emergency room. The other facility, which is not as familiar to the public, is the former, what used to be called the University Hospital at USC Health Sciences campus, which is now known as of November 1st, Keck Hospital at USC. And this is a different approach, and it has a different vignette, and I'll get into that shortly. Just for those of you who wish to be reminded, the original LA County USC Medical Center now, which is a new structure here, you see in this portion over here, is on the meeting of the Golden State and the San Bernardino freeways. And if you notice here on the map, the old General Hospital is immediately adjacent to that, and for the most part, except for the first 4 to 5 floors, it has been mothballed. The first 4 floors are now used primarily as administrative office space. But the main the county facility are these 3 buildings, which are actually joined together, you see there. By comparison, if you look at this larger map, the LACUSC Medical Center is here in the southern portion, with this being the new building. The USC, what used to be called the USC University Hospital, or Keck Hospital, is in the northern part of the campus. The medical school is right over here, immediately to the north of the county complex. And a block north of that is the USC University Hospital, which is now known as Keck Hospital of USC. And that is approximately about a 375-bed unit, which has specialized advanced care for patients who have already been diagnosed with very complex disorders. So it has a cardiothoracic unit. There are transplantation services there for heart and lung, as well as for liver, pancreas, and kidney as well. This is an aerial view of the Keck Hospital system. The main hospital is this one here with the black and white horizontal lines you see over here. This is the Doheny Eye Center, where many of the clinics where some of the respiratory patients are seen. And the 2 main clinic buildings are seen over here. This is the Healthcare Consultation Center, number 2, Healthcare Consultation Center number 1, where the surgical services are provided, including the cardiothoracic services. And this is just a frontal view of the Keck Hospital of USC. So the scope of services is that at the county, approximately 700 patients with COPD are followed as outpatients each year. On the private side, at the USC Healthcare Consultation Center, approximately 250 are followed. The size of the physician group at the USC Pulmonary Critical Care Division is 27 physicians, with 23 who are involved in one way or another in patient care. And there is now an electronic record system which has almost completely been incorporated into the medical records keeping system at the county USC, which actually in some respects is a little bit more advanced and ahead of its time than Keck Hospital. The Keck Hospital and the Healthcare Consultation Centers are now in the process of developing the Cerner system for electronic medical records. At the county hospital, the new county hospital, we use a combination now of 2 programs, one called Eclipsys and Affinity, for recording all kinds of the histories and physicals, diagnostic data, radiographic data, and it is estimated that probably by the middle of 2012 that these 2 systems will be merged into one over-encompassing electronic medical record system. And from what I have heard also that this system will now enable also the transaction or the transmission of information to other county facilities within LA County. Now, both facilities for acute care provide screening, diagnosis mostly for general pulmonary. We also have sleep laboratories on both the county side as well as on the Keck private hospital. Both facilities have very large intensive care units. At the county, there is a complex of intensive care units, each one of which is roughly about 16 beds apiece, comprising a total of 50 beds. It is primarily a closed system run by pulmonary care intensivists. The Keck Hospital has 75 total ICU beds, but it is more of a semi-closed system where the cardiothoracic and other surgical services share the care of the patient, but most of the internal medicine and other medical problems of those patients, primarily postoperatively, are handled by the pulmonary critical care division. And then at Keck Hospital, there is a cardiothoracic institute which administers the heart-lung transplant program. Currently, right now, USC is under the direction of Dr. Vaughn Starnes, the transplant service, and is averaging approximately 20 lung transplant cases a year. As far as chronic care goes, the outpatient clinics at the LACUSC Medical Center average is comprised of a single weekly chest clinic, which totals approximately 6,000 visits per year, of which roughly 1/3 comprise of patients diagnosed with COPD. And of course, these are patients who have been documented as having COPD by spirometric technique. And there is also a small pulmonary rehabilitation clinic that opened in 2006, of which I am the director, and that averages about 250 visits per year. About 90% of those patients have COPD, and there's a smattering of patients with idiopathic pulmonary fibrosis and a few obesity hypoventilation syndromes. At the Keck Hospital, across the street, the main clinic is a healthcare consultation center, where the pulmonary clinic sees approximately 2,500 visits per year, again, of which about 1/3 are comprised of COPD patients. And that there are a number of smaller specialty clinics in the Doheny Eye Hospital across the street, which are devoted primarily to cystic fibrosis. These are primarily young adults into their 40s, even 50s. Recently, a pulmonary hypertension clinic was established primarily for patients with primary pulmonary hypertension, but there are some patients who have severe secondary pulmonary hypertension due to COPD and restrictive lung diseases. And also at the Doheny Eye Hospital, there's a lung transplant clinic which conducts evaluations and pre-op evaluations and follow-ups after surgery is completed. As far as pulmonary rehab is concerned, the one dedicated formal clinic right now is established at LACUSC Medical Center. It's a once a monthly clinic to evaluate referrals from the outpatient chest clinic at the county and also the various comprehensive health centers, primarily from El Monte and the Roybal clinics in East LA. Right now, we are limiting it to primarily just 5 patients per clinic, totaling about 250 visits per year. Most of the patients referred have severe COPD, and by severe I mean we're talking about FEV1s of less than 50% predicted, and some of them are as low as 25% predicted. And as I mentioned earlier, there's a smattering of idiopathic pulmonary fibrosis and a few pre-op lung transplant referrals from the Keck Hospital, HCC, are referred, and they have to go through the usual screening process regarding their medical status and et cetera before they are plugged into the program. It is recommended that most lung transplant patients go through an intensive rehabilitation program prior to surgery in order to optimize outcomes. At the Keck Hospital, right now we're in the process of negotiating with administration to establish specifically a chronic respiratory disease pulmonary rehab clinic. It's been kind of a long slog. We're hoping that it eventually will be opened up within a year or two. But right now, if we wish to refer a patient on the Keck Hospital side, for rehabilitation, there is a general rehabilitation clinic primarily geared for patients with their orthopedic, rheumatologic, and neurological disorders, but there are respiratory therapists and physical therapists there who have been trained specifically in the area of cardiorespiratory rehabilitation. So in terms of referring patients to them, that has not been a problem so far. In terms of support groups, we do have a smoking cessation program where we offer both pharmacologic as well as behavioral therapy programs for patients seen in the chest clinic at the county. And then also on the private side in the Keck Hospital, primarily geared for patients who are being considered for lung transplant, being screened for lung transplant, and for those who also have cystic fibrosis, which is a form of obstructive airways disease. We provide classes on disease education, options for management, including lung transplantation, lung volume reduction surgery, nutritional counseling, and quality of life counseling for individuals with these advanced respiratory disorders. As far as palliative services concerned, this is primarily geared in the county side. It is available primarily for patients who have been hospitalized in the intensive care unit over there. Approximately 10% of the patients who come to our ICUs at the county have end-stage chronic lung disease, and of course many of them are intubated on mechanical ventilation, and if it turns out that it's going to be difficult to be able to wean them off the ventilator, obviously we refer them to facilities such as Barlow Hospital, which is up near Dodger Stadium, occasionally to Rancho, occasionally to Kindred Hospital System for prolonged weaning. But if it turns out that they have some acute overlying superimposed problem like a life-threatening pneumonia, or if they're septic and they're in shock and it doesn't look as if they're going to be able to make it, we have discussions with the family about the end-of-life issues and to help to deal with this with them. It is provided by a specifically dedicated palliative care service, which is a team of physicians who have been trained in the area of palliative care. Dr. Richmond mentioned about the various pathways available for clients who have various degrees of pulmonary impairment. For those with mild impairment, we continue evaluation and continue regular follow-ups in the clinics, primarily on the county side, periodic pulmonary function testing, smoking cessation programs, and there's also specifically a smoking cessation program, which I mentioned earlier, consisting of pharmacologic and behavioral modification and counseling. It is a little bit more informal on the healthcare consultation side, on the private side, but we have 9 physicians who are working on the pulmonary clinic over there, and they will provide counseling regarding smoking and behavioral modification for individuals there. In addition to that, other services are available, including psychological services, social work services, although at this time they are not combined as a unifying team. However, if any of the doctors at the clinics on either side wish to refer patients to these other allied health programs, they can do so without any difficulty. For those who have severe pulmonary impairment, options are offered for the patients, and in those cases who are suitable candidates, they are referred to the transplantation team for evaluations. And I put there conditions permitting because it has a lot to do with psychosocial, financial. Psychosocial is the most important. Obviously, the story doesn't end when you get a new pair of lungs, because you have to have for the rest of your life a very strong support service to be able to manage your condition. There's issues regarding anxiety, depression, feeling of loss of self-esteem, and the whole name of the game, of course, with any rehabilitation program, as it is in the transplantation program, is to try to have people regain as much of their independence as possible so they can continue to function effectively in the community. These patients are periodically referred for cardiopulmonary exercise testing to evaluate the cardiorespiratory reserve, or at the very least to undergo 6-minute walking tests. And the 6-minute walking tests are also offered, usually done routinely for patients who are in the pulmonary rehabilitation clinic on the county side. One of the sections in the template provided by Dr. Richmond included a comment on the payer mix and how it affects the patient care and referrals. As you might suspect, the payer mix is quite a bit different, both on the county side and the private side. On the county side, where we see many more COPD patients, about 60% are Medi-Cal, which is pretty good. It used to be a lot less than that about 20, 30 years ago when I was training. Self-pay is about 20%, and Medi-Cal pending, which generally means that these are patients who are unable to pay at all, many of whom are from other parts of the world, are about 20%. At the Keck School, it's about 1/3 PPO, 45% Medicare, and this kind of fluctuated about plus minus 10% over the last 15 years while I've been there. And then the rest, as you see over there, smaller percentages of HMO, Medi-Cal, and self-pay individuals. But finally, the unique strengths of our programs is that I think compared to many other healthcare centers in other parts of the country, and perhaps even here in LA County, we have a very wide demographic distribution. Close to 2/3 are of the Latino population. I think that's probably even burgeoning even more. So for those of you who might be interested in incorporating this unique group of the population, this is basically a gold mine for investigating and looking into the healthcare situation amongst this population. Secondly, we have faculty with many years or even decades experience in the management of chronic respiratory disorders with emphasis on COPD, cystic fibrosis, and now more recently pulmonary hypertension. Some of our faculty, such as Dr. Barbers, is interested particularly in asthma and immunology. And then more recently we set up a lung cancer institute at the Norris Hospital, which is a multidisciplinary unit for patients with lung cancer comprising of pulmonologists, oncologists, cardiothoracic surgeons, as well as the psychological and social services provided. And then finally, of course, for those patients who have far advanced lung disease and who are suitable candidates to be considered for transplantation, there is a dedicated cardiothoracic institute which runs the heart-lung transplant program, also a very multidisciplinary approach.